Hi, my name is Melissa Kobrenski, and I'm one of the inpatient diabetes nurse educators. And my co-author is Allison Hanley, who is an inpatient medicine PHMNP. We've been working together at Boston Children's for many years, and over the past 15 years, we have worked together on inpatient medicine. And our commonality has been caring for patients with diabetes and teaching the parents about the management of the diagnoses, often new onset diabetes. So our EBP poster's title was Incorporating Inpatient Use of Continuous Glucose Monitoring to Improve Outcomes of Pediatric Patients with Diabetes by Reducing Hypoglycemic Events. Sufficient management of diabetes requires multiple glucose checks throughout each and every day, and the standard of care in regards to checking glucose levels of patients in the inpatient setting has been point of care finger sticks, which, as you can imagine, can be pretty overwhelming and traumatizing for children and their parents, especially the young ones who have just been diagnosed with a life-altering diagnosis. The COVID-19 pandemic opened the door to a technological advancement that had already actually started gaining momentum in the outpatient world, which was the continuous glucose monitoring, also referred to as CGM. During the pandemic, the FDA granted emergent approval for the use of CGMs in the hospital setting, and outcomes of related studies of both adults in the inpatient setting and for children in the outpatient setting indicated that diabetes management could be improved for inpatient pediatric patients via the adjunct use of CGMs. So together with our mentor, Jean Potter, we asked the question, for pediatric patients with diabetes, does continuous glucose monitoring as an adjunct to point of care blood glucose monitoring compared to point of care blood glucose monitoring alone decrease hypoglycemic events and or response times to hypoglycemic events during a patient's hospitalization? We did an electronic database search utilizing PubMed, Summon, and Sage journals, which ultimately yielded 4 level 3s of high quality articles and 2 level 3 good quality articles. We also had 1 level 5 high quality clinical expert opinion. Our evidence from these sources revealed that routine CGM use improves 3 things: time and range, which includes reduced hypoglycemic and or hyperglycemia events, hemoglobin A1C values, and patient and provider satisfaction. We thus recognize the need for a practice change at Boston Children's and therefore recommend the initiation of routine CGM use as an adjunct to point of care blood glucose monitoring in the inpatient hospital setting. This would help to identify, prevent, and reduce the incidence of hypoglycemic events in pediatric patients with diabetes, and to also enhance healthcare provider response with timely assessment and intervention. Boston Children's, in the wake of the FDA emergency, approved approval for CGM use in the hospital setting during the pandemic. It's already implemented a guideline which permits patients who were previously established on CGMs at home to continue to use their CGMs in the hospital, which requires just 1 daily point of care blood glucose finger stick for quality control purposes in the hospital. We therefore wish to introduce a practice change which would benefit all patients who are admitted with diabetes, whether newly diagnosed or previously diagnosed, knowing that utilization of CGMs for all of our hospitalized patients can improve their outcomes by decreasing the incidence of hypoglycemic events, improving healthcare provider response time to hypoglycemic events, and increasing both patient and caregiver satisfaction. How does this translating evidence into practice? In order to accomplish these goals, I'm initiating a new CGM on admission and educating caregivers on it prior to discharge. The following action plan is required. First, to complete a cost analysis, to evaluate CGM alarm or some type of notification system, to review insurance coverage, assess access to inpatient CGM supplies, modify hospital CGM guidelines, educate nursing staff, and establish a formal QI plan for ongoing monitoring of CGM measures and outcomes. We are very hopeful and excited about this endeavor on behalf of our patients, and thank you again for listening and viewing our poster.